how would you describe, Chelsea, the process for conducting a thorough evaluation of a child's speech and language abilities?
Sure. So I send them some pretty comprehensive intake forms to fill out even before they come in, that ask a lot about the background history. We have to know things like any stresses or traumas they went through, any medical history, especially if they've had their hearing tested or not. We have to make sure that they're able to hear well if they're going to participate in the speech language testing in person. So then when the parent comes in, we review everything, and I'm able to ask them some follow-up questions about anything on the forms. And I'll observe the child, and as they interact with their parent, I might have some toys and books and activities available so I can get an idea of how they communicate and interact, and what techniques the parent might use with the kids as they interact with the kids, so that we can work on scaffolding some help with the parents for those techniques. And then I also do formal testing. So for speech and articulation assessment, and an oral motor evaluation, and for language, formal assessment that test their receptive or understanding and their expression of language, as well as looking at other components of language, looking at fluency, and pragmatics or social language are important.
Oh, that's amazing. That's really cool. That's really cool. So what's like your favorite thing about your job?
I always feel like I'm lucky because I get to play with toys all day with kids and get paid for it.
Pretty cool.
So I do my job fun and rewarding, and I love to celebrate the successes with the kids and with the parents, with the feeding and the speech.
That's really great. That's really great. Can you discuss any specific or elaborate on any specific approaches or techniques that you find particularly effective in your speech language therapy sessions?
So there are many, but it really depends on that individual child and what their individual diagnoses and needs are. So, for example, if I have a child that comes in who is really shy and clingy to the parent, maybe an infant or a toddler, I might look at doing more of a following the child's lead type of approach, like more floor time type of therapy. And even though I'm following their lead, I also use structure. So I will structure the therapy environment with specific toys or activities that are going to target the specific sounds or words that I want to work on that day. So they still have a choice of what they want to go to, but their choice, little do they know, is based upon things that we need to be working on. Another thing might be if I have a child with sensory needs, I might want to incorporate some movement or sensory regulation activities into the therapy. So we have a sensory swing, we have a trampoline, and I have different activities that I do with kids to kind of help them regulate depending on what their needs are, so that they're better able to focus and attend. And oftentimes those activities bring out even more speech or language. And another example might be a child with childhood apraxia of speech. So they have a motor planning disorder where they're unable to say the thoughts that they're thinking. So we might do a more movement-based approach where we do a combination of drill and spontaneous utterances so that they can learn the words that they need to learn and then have the opportunity to practice those in a more natural way.